Hello, and welcome to Plugged In, the video series that helps you get plugged in to what's going on inside Availity with products, strategies, and initiatives. My name's Krisi Hutson. I'm a product line director here at Availity, and I'm joined by my Chief Product Officer, Bobbi Coluni, and the CEO of PriorAuthNow, Joe Anstine. We're going to talk a little bit to you today about the recent alliance between Availity and PriorAuthNow to create the nation's only delivery network for integrated prior authorization solutions. We're going to dig into what does that mean for both providers and payers in this complicated market. So thank you both for joining me here today.
Thanks for having us.
Great to be here.
This is definitely a problem that's been prevalent in the industry for quite some time, Bobbi. I'd really like to start with you and kind of let me know, why has this been so challenging?
Yes, prior authorization is such a complex transaction, much more so than eligibility verification or claim submission. You have to consider the situation we have. Every payer has different rules about what requires an authorization, and there's not always transparency on providers' part as to what's required. So this creates situations where sometimes providers are concerned, confused, and sending in authorizations when they're not required, creating more work than necessary, and other times not sending in the required documentation, clinical documentation, for the authorization. It's also a situation that requires a lot of coordination between different parties, administrative staff, clinical staff, and utilization management vendors. So it's kind of the perfect storm: complexity, variability, lack of standardization, and all of this results in, all too often, situations where this is done via fax and phone.
Yeah, no, it makes a lot of sense, Bobbi, and we can really see those pain points with both of our customer base, so both payers and providers, Joe. So you started in the prior authorization space around 5 years ago or so. What really drew you to this as a problem, and what have you brought to actually address some of those in this offering?
Yeah, it was clear that we talked to both providers and payers that sort of prior authorizations were the last frontier of revenue cycle. That was still a major problem. And so what we have done is we've taken a sort of a common practice in other industries and applied it here, which is we're meeting providers and payers where they are at. And what that means is we're not asking them to jump out of systems they're already in, like the EHR. We have real-time, bi-directional communication within their work queues. And when we need to have a human take action, we can switch to a UI and drive meaningful interactions. So eliminating the burdensome administrative tasks and replacing them with fewer, more meaningful interactions in the systems they're already in today.
So Bobbi, based on what Joe was sharing and what they're bringing to the market, why is Availity well positioned to help in this journey?
Availity has the largest health information network connecting payers, providers, and trading partners. Last year, 2021, we had 13 billion transactions coming through this network. So there's a great opportunity to add value to these transactions, add more intelligence, so we're reducing manual touch points and improving collaboration between the stakeholders. Availity has been working on this for some time through our Essentials product lines and also APIs that inform some of those transactions. We're taking this to the next level with the partnership with PriorAuthNow.
So I'd love to get a reaction from both of you. I'm hearing each of our separate journeys a little bit, right? And why is now the right time for us to come together? How are we going to create, build on those synergies and move forward? Why is now the time? So Joe, do you want to start?
So I think it's one of those rare partnership where everything lines up. Availity has done a magnificent job in terms of creating connectivity with health plans for a myriad of things, but in particular prior authorization. And then they've also built a really important part of sort of the next generation auth platform, which is a multi-payer portal. Where we come in is we are literally taking the connectivity that is powering that portal, and we are moving it to our EHR integrations sort of to take it on, to address the last mile. So providers who are interested in staying within their EHR and having interactions with Availity's health plans as well as other health plans throughout the country, they now can stay in their workflow and they can replace sort of the administrative manual tasks with more meaningful interactions with this platform. So we're very excited to to extend our payer connectivity, as well as help the folks who are using the portal today have an option to move those interactions directly into the EHR.
Fabulous. And Bobbi, what does Availity think is the right time now? Why is this the best time to move forward?
This timing is important. It aligns with our work to do larger transformation on these processes, which are often burdensome. So the work with PriorAuthNow is really augmenting and accelerating, bringing to market sooner some of the work we're doing on digital transformation.
Well, this has been really exciting, guys. just sort of as we wrap up, what would we like to, really make sure our listeners hear today? What are the most important points you'd like for them to take away?
For me, this is just the tip of the iceberg. We are laser focused on prior authorization, but the way we're approaching this, it goes well beyond a term that everybody uses, which is automation. This is not just about automating the manual administrative tasks. This is about leveraging coordinated connectivity, meeting both providers and payers where they're at, and replacing the transaction of prior auth with something we like to call intelligent collaboration. Our ability to eliminate the administrative burden, yes, that's a given, but oftentimes it needs to be replaced with more meaningful interactions that allow payers and providers to collaborate on care decisions and ultimately improve patient outcomes.
Yeah, absolutely. This changes the nature of prior authorization from back-to-back transactional flow to something that really transforms the whole process and drives reduction of waste, but importantly, improving patient outcomes.
So Bobbi and Joe, I just want to thank you so much for joining us today. This has been really exciting to hear about, and I can't wait to see how this journey unfolds. And I'd also like to thank all of our viewers for tuning in today to another episode of Availity Plugged In.